Hi, my name is Sarah Olsen. I'm a second year UQ-Ochsner student, and I'm delighted to welcome you all to another episode of White Coat Wednesday here from Brisbane, Australia. And I'm here today with Dr. Charles Kantrow, a true New Orleanian. He is the Deputy Head of Curriculum, the head of the Lejeune Society, and a physician in pediatrics and child health here at Ochsner. Welcome, Dr. Kantrow.
Thank you so much.
And then I think we'll jump right into the first question. So, Dr. Kantrow, how did you end up becoming one of the Ochsner Society heads, and what has that role been like for you?
So I was the clerkship director for the pediatrics portion of the rotation, and I was involved from the very beginning, from the program's start. It's something that I've been involved with for a long time, and so when this opportunity came up and they asked if I'd be interested, I thought it would be an interesting thing to be doing, and it's turned out to be a really fun and exciting adventure.
Can you talk about some of the rewarding aspects and then maybe some of the more challenging aspects of being a society head?
So the rewarding aspects are easy. We get to watch people like yourself go in, develop confidence, become spectacular physicians, and then go out and make a difference in the world. That's as good as it gets. So it's something that we're very proud of, and we're very proud of you all when you do that. So it really is a wonderful, wonderful thing for the school and for our communities.
Mm-hmm. Any more challenging things you can think of?
So challenges are really having to do with the fact that you guys having to travel such long distances can be rough. And I think that we're using a curriculum here in Australia, which is wonderful, but it's a little different than what we use in the U.S. So there's some differences there that I think sometimes folks are a little surprised by. And so it's challenging sometimes to explain to other schools what we're doing. We've been doing it long enough, they now seem to get it, and they recognize what we do and the high quality students that we generate from our school. And so it's now an easier conversation.
What made you decide you wanted to go into pediatrics, and were there any experiences you had during medical school that solidified that decision for you?
Yeah, so I got married in the middle of medical school, which, by the way, I don't recommend, just because it's hard for your spouse. And so I got married, and I went on my rotations during my third year, and then at the end of your third year, you have to start trying to decide what you'd like to be. And so I sat with my wife, and I said, what do you think? She says, well, if you want me to stick around, you might want to consider pediatrics, because the only time you were really happy and not a not so nice person was when you were on pediatrics. So it was a pretty easy call at that point.
It's kind of a collaborative decision between you.
A collaborative decision. If you want me to stay, you might want to do this. So yes, absolutely.
Interesting. Okay. And then, given your extensive experience in pediatric care, what advice would you offer to medical students and residents who are interested in pursuing a career in pediatrics, especially in complex cases like those involving congenital diseases, which I know you have some experience with?
Yeah, I mean, I think you have to read constantly. We read constantly. I know the students often think that we just, off the top of our head, can tell you all sorts of things, and we can. But the reality is that medicine's very complex, and we read all the time to keep up, to learn about our patients, to figure out what the newest and best opportunities are to treat our patients and to provide outstanding care for them. And that takes constant upkeep. So you're not going to stop learning after this. You'll never stop learning.
Great.
You have to be, we talk about a lifelong learner, and that is what you have to be successful in medicine. If not, you'll be out of date in 2 years. So it really is important that you stay ahead.
Can you share more about your role as the medical director of Ochsner's myelodysplasia team? What does this role entail, and what are some of the challenges and rewards of leading such a specialized team?
So the myelodysplasia team is also known as the Spina Bifida Clinic, for folks who don't always understand that term. And the Spina Bifida Clinic is a multi-specialty clinic that includes physicians from multiple areas. So I'm the general pediatrician who runs that clinic. However, I have a pediatric urologist, a pediatric neurosurgeon, pediatric orthopedist, social workers, physical therapists, and occupational therapists, all in that clinic. And so the children come into the clinic and stay in a room, and then we all rotate around and see all of those patients. And we then meet at the end and talk about how are we going to manage this? Because often they need procedures, they need further appointments, and how can we do this in such a way that we can provide the best care for the families and for the children without really causing disruption for the families because they can't be at our institution every week. They have to have a life. They have to be normal kids to the best of our ability. So it's a great clinic. I love working with the folks that I work with. They're world class, and we provide a great service for these patients and their families.
So it does really sound like a multidisciplinary team.
Truly multidisciplinary, yeah. All of them involved. We literally sit down at the end of the clinic and go through every patient, and everybody talks about what they need to do from their point of view, and then we organize it all so it can be done efficiently for the child.
Wow. And how do you balance the demands of patient care with your passion for teaching medical students and residents?
So, it's interesting. People ask that a lot, and I haven't found that to be that hard of a problem because I think if you're in the environment as a medical student and you're seeing the patients with me, you're getting a sense of how I do it. And then I'll arrange for you to be seeing patients independent of me and then come tell me what you think. And then I'll go see the patient and verify that you've done it right. So there are a lot of benefits for that. Number one, when we're doing it together, I can see what you're doing. Number two, when you do it and then come back and talk to me and then I go talk to the patients, I often get tremendous feedback from the patients about, we really like that medical student. They were really good, and you should tell them they're really good. So it's a really nice reaffirming thing that you guys do a great job. You don't always realize it, but the patients often are the ones that really let you know that you did it right. We try to give you feedback, but students tend to be very nervous getting feedback from senior physicians, but they really are excited when they get feedback from a family. It's a real sentinel moment for a lot of students.
That really makes me look forward to my clinical years.
It's what makes it fun.
And are there any specific teaching methods or experiences you find particularly effective in shaping future pediatricians specifically?
I don't think so. I think I'm not a big fan of sort of what I call the scary teacher mode. I think a lot of people have seen that over the years on TV, and surgeons often are portrayed as very difficult, hard people to work with, and they really mostly aren't. And in pediatrics, almost none of them are. It's hard to be a pediatrician and be a difficult, brusque person. So
the kids aren't going to like that.
The kids aren't like it. The families aren't going to like it, and so folks aren't like that. So I don't think that usually is a big problem.
So in what ways has the field of pediatric medicine evolved since you first began your career?
So I trained in a time before many of the vaccines that you now get were made. And so I unfortunately saw some of the diseases that we now prevent with our vaccinations. And to have to explain to a child's parents that your child has meningitis and now has brain damage and may never walk again is horrible. I don't have to do that anymore, but I did in a day. And I'm so fortunate that our vaccines provide such great benefit. Our biggest challenges now are those who don't believe in vaccines. And that's a whole different animal, a whole different discussion. We don't have a lot of them, but it's increasing in the States and becoming a little bit more of a problem. And we're starting to see diseases we haven't seen in many, many years. We've had measles outbreaks now. So we are starting to have some challenges as the world has opened up post-COVID and everyone is traveling. Those who are unvaccinated are bringing things with them in many cases. It's one of those moments where I'm happy to be one of the physicians there, because being one of the older people, I've seen some of these diseases, so I'm able to walk in and say, oh, that looks like XYZ. I haven't seen that in 25 years, but that's what it probably is, and here's what we need to do. So it is helpful from that point, but it's a little scary too. I mean, we have the means to prevent diseases in children, and folks not doing that, it's a little bit of, it's a point of frustration for pediatricians, because our thing is to do the best thing for the children, and we hope that the parents will trust us, and most do, but not all have that approach.
And so what advancements or changes do you anticipate in the future, particularly in the areas in pediatrics in which you specialize?
So our ability to better analyze and care for the patients, in particular, once upon a time, meaning like last year, you would have to probably sedate a child to get an MRI or to have some of those things done. And certain procedural stuff requires a lot of time and investment in getting the right people there to keep the child sedated and protect the child's airway, and the parents couldn't necessarily be there. So it was a lot more challenging. And now, we can do an MRI, a fast MRI, baby just lays there for 2 seconds and they get a perfect MRI. They don't need to be sedated and have those sorts of things. So the technology changes have really improved the quality of care for the patients and made our lives much easier from the standpoint of trying to schedule and get these things done and not having to disrupt families' lives.
That's all the questions I have for you today. It's been really great to talk with you, Dr. Kantrow. Thanks so much for coming in. And thank you all for joining us on this episode of White Coat Wednesday here from Brisbane, and we hope to see you next time.